bags, you have dual lumen stomach pumps, Salem sump pumps. Okay, you have a couple of these, 2 or 3, I think. You'll notice it says the size. This is a 14 French. So that's a 14 French. And Cheryl, correct me if I'm wrong, but the bigger the number, smaller the tube size. Okay.
Kind of like needle sound.
Yeah, it's confusing because, so the bigger the number, the smaller the size. Always make sure you ask the physician, what size do you want? Because I've had experience where student and I put this NG tube down a client, a patient, and he came in and he said, oh, that was really good, but could you put a smaller one in? I'm like, really? Seriously?
Oh, no.
I said, so we have to go back and tell the patient we gotta do this all over again. Yeah. Also, a good reminder is to always make sure you have an order to discontinue it. It happened, our director Kendra talks about when she was with a student and another nurse said, oh, you can discontinue that NG. So they did. There was no order to discontinue it. So they had to put it back down. Okay? Yeah, that's why I said yuck. It's uncomfortable. So after they get in, they're always really, and I'm glad that we put it in. So, okay, so you get your NG. You're gonna have to have a glass of water and a straw. Okay. You also you'll have to have your hand sanitizer, your gloves, a towel, pH paper, and some lubricant. This is the lubricant that you use for the mannequins, okay? Otherwise, when we're in the clinical setting, we use water-soluble lubricant like KY jelly, okay? But this is the lubricant that you'll use, and we keep them back here on this table, on the little cart here, okay? All right, so it's always best to work on the side that you are your left or right-handed, so you can have your dominant hand, okay? I'm gonna put the patient up to a good working height. Oh, and you'll also have to have some suction device. You'll have a canister that will be connected to a vacuum, to a suction, and your doctor will tell you what type of suction you need, low intermittent suction or continuous suction, okay? He or she should specify that in your orders. And so this is the canister. And I will get that hooked up. Okay, Cheryl, do you wanna read for me, please? Kind of gonna go through you use your hand sanitizer, you come in, introduce yourself. Hi, Mr. Jones, my name is Lori, and Dr. Throckmorton has ordered that we put a tube into your stomach to help release some of that air. Have you ever had one of those before?
No.
Okay. Just need to check your name, and can you tell me your name and your date of birth? Okay.
And then part of the assessment would be inspected the condition of the patient's nasal and oral cavity.
Can I have you open your mouth? Okay. And have you had any surgeries on your nose or any trouble
Nasal
breathing out of
surgery.
one?
Deviated nasal septum.
Yep. No, he hasn't. Have you ever
And-
broken your nose? Because it's going to depend on, those things depend on which side you're going to use. So you kind of have them do the sniff test, okay? And see which nair they can breathe better out of, okay?
And then part of the assessment would be to verify why we're putting in the NG tube. So we would auscultate for bowel sounds,
And he has none.
palpated patient's abdomen for distension, rigidity, and pain, and that's what you talked about earlier. The tympanic sound.
Tympanic sounds in the belly, yeah.
And then, what's the level of consciousness? Can they follow instruction? That's part of our assessment.
Because they will have to be able to follow instructions, because they're gonna have to drink water while we put this down.
So now assuming, based on our assessment, we're gonna go ahead and put in the NG tube. Our planning now is going to be to identify our patient again and explain the procedure which you did, and determine if the patient has had an NG in the past and which NARI was used.
I'm going to use his right arm. And Mr. Smith, was it Mr. Smith? I can't remember what I called him. Mr. Smith, this may be a little uncomfortable for you, so if you get where you can't tolerate anymore, let's have you raise your arm, and that kind of is a distress signal to me that I should stop and give you a few seconds and we'll wait to proceed to put the rest of the NG tube down.
I would appreciate that, because I'm kind of frightened for this whole procedure.
Understand that.
Yes.
Understandable.
And then, did the doctor order this?
Yeah, but Dr. Throckmorton did order that you have
Okay.
this tube put in because you've got a lot of gas in your stomach and it's just not moving through in the bowels
Okay.
yet.
Great, so now we're gonna put it in, and so this would be the implementation in the nursing process. And we position the patient in what position is this called?
Fowler.
Semi-fowlers.
So is that 45 degrees?
Yeah, kind of, so they're sitting upright a little bit. And then, we can have the patient blow their nose, being they're oriented, to make sure they don't have any stuff in there,
Snot
any
in there.
secretions. And sometimes there's blood, I've seen blood, and it's caked in there or whatnot. And then place a towel over the chest, which Lori did, and put the amethyst basin within reach, which,
Oh,
grab one. I don't know, right here. Do you have one there?
Those are the kidney bean ones.
I was thinking for the bags.
Should we use this, Lori? This would work.
Yeah, I was looking for the bags, the bags, emesis bags. Best thing ever made,
Yeah.
emesis bags. You all should buy some, if you have children. Okay,
Provide for privacy.
so I pull the curtains,
Sit
shut
on
the
the
door,
appropriate
he was
side
by,
of the patient.
what's that?
Stand on the appropriate side.
Okay, I'm right-handed, so I'm gonna stand on his right side.
And hand hygiene, apply clean gloves.
I did that, okay.
Instructed the patient to relax and breathe normally while including each NARI. A repeated action for other NARI, select a nostril with greater airflow. And I think you talked about that earlier.
Just do the sniff test.
Now we're gonna measure the distance to insert the tube properly.
Okay, so on your tube, it's got little markings here. Oh, I need some tape.
I got some.
So it has little markings, so you kind of want to, once you measure it, you'll kind of know, then that gives you an idea. Look to where you marked it, put your finger there, we'll put a piece of tape on there. Kind of gives you an idea of how far you're going to be putting the tube in, okay? So, we measure from the nose to the ear, or you can measure around the ear to the xiphoid process, okay? So I'm gonna go to about 55. This was easy, I remember 55.
Okay, so part of our supplies then, I just going off our list from, we have pen light,
Mhm.
the marker. We're gonna remember 55. Well,
55 is what I, yep.
Tape or attachment device, skin adhesive, water soluble lubricant. We don't have any, oh, okay. Otherwise, that'll be your KY. I don't know if you have that in your packages, in your
I don't think
blue
so. But to go the
packs.
mannequins, you have to use this stuff, okay?
The 60 millimeter larger syringe.
Yep.
And, the tube fixation or anchoring device, and we're gonna use tape.
Yeah, I don't have
Got our pH.
Okay.
All right, we measure, give the glass of water with straw to the client.
Okay, I would have him
Lubricate
hold this,
the
okay?
tip of the tube 3 to 4 inches with water soluble lubricant.
So if I had water soluble lubricant, I would put it on this, okay? This is not a sterile procedure. Your stomach is not sterile, okay? okay?
So you said you would give the patient the glass of water and straw?
Yep, he or she would hold the glass of water and straw. And you're gonna have to tell them, now, Mr. Smith, every time you swallow the water, I'm going to push the tube down farther, okay? And we start having them do that once we get to the back of the nose, the nasopharynx area, okay? So then I would put my lubricant on here. Lube it up so it slides easily, okay?
So you go ahead and put that in.
Okay, so now I'm going to, gonna have him,
And rotate it gently as you get to the back of the throat. That's usually where it's gonna come out the front.
yeah, and if you think, oh, it's just going and going and
Yeah.
going really nice, and
You'll
you
look
open
at-
their mouth and you go, oh my gosh, it's all curled up in the back of their throat. And that'll happen, all of a
Yeah.
sudden it comes out their mouth, and you go, oh, that wasn't where it's supposed to be.
I think your biggest challenge is to get it past here.
Once you get it past, and it slips past the pharynx area, and it'll go down real easy. But it's just getting it to the back of the nose. Okay, so I'm gonna aim down, have his head, have him tilt his head, hyperextend his head, aim the tube down. No, that nare's not gonna go this way. Yes, it was this. So this nare, okay,
Rotate tube gently as it passes through the nasopharynx.
okay, so now I think he can start drinking. So he's gonna take a sip. Once he swallows, I insert it farther. He swallows again, I insert it farther.
Until you come to the place where you have marked. It's 55.
Almost there.
And you're twisting it as you go.
Yeah. Okay.
Actually, once you get past that nasopharyngeal, you go right on down.
Okay.
But you may have to have them
Put their head,
down, chin tuck,
chest, yeah.
to get it to go down easier. Just depends on your patient, okay? So once it's there, what do I
Can
do
we
next?
secure it?
Okay. Usually your kits, your NGs come with a securing device, but our kits don't today, so. Kind of put it in a chevron, it crosses, okay? So now I am going to verify placement, so I'm gonna make sure, cause doctor didn't order an x-ray. So I'm gonna remove some
We're in
gastric.
Haiti.
We're in Haiti,
Yeah, we
yeah.
don't have any x-ray.
We're gonna remove some gastric contents. Usually, you're gonna get it, those contents are gonna come right back. When you put in that stomach, cause it's full, you're gonna, and this is just a plug, so it doesn't, the contents don't come out all over the place, okay? So once you get those contents, you're gonna put them into a little glass. You're gonna take then your pH paper, and you're going to put the pH paper in there, and then you will read the pH according to your scale, okay? And our stomach should be
Acidic.
acidic, yeah, very acidic, because we got that hydrochloric acid in there, right? So is it?
So
Yeah.
low.
Well, this is water. It's balanced. It's like, well, not really. 7.
That's normal, pH
Yeah.
normal, then, yeah. So so it's gonna be 5, 6, it's gonna,
Yet, I've just looked, it said 1 to 4 for your gastric.
Gastric,
If
very
you get
acidic.
down into the intestinal, then it's greater than 4. It's
Okay.
around 6. But I was
so
think-
you know normal pH, well, arterial blood gases is,
7.35 to 7.
7.4.
yes, 3.5 to 4.5, I had to think, 3.5 to 4.5, yep. Okay, so now it is secured, we've tested the pH and we're good, it's correct, it's in there, so now
You're
I'm
gonna
gonna
connect
leave my
the tube
gloves
to
on
suction.
because when I take this out, the plug out, it might leak. Well, I don't have to take the plug out.
Nope, you don't have to. No. Okay. I think the thing in my practice, and Lori, probably you too, But I think in years past, where we've gotten the most hung up is on that little pigtail. And that's just part of the anatomy of the tube, it's part of the engineering of the tube. It puts air in there somehow so that the whole thing